Hi, my name is Brock Fisher. I'm the construction project manager for Sunrise Community Health. And this is our Windsor clinic that we just opened up a couple months ago. So let's go take a tour. So the first thing that you'll notice once you walk inside is we have our welcome sign that we have at all of our clinics. Basically, the sign just has welcome in numerous different languages. As we walk into the clinic, you walk into the patient waiting area or the lobby of the clinic. It was designed to have 2 receptionists. Right now, we only have the staffing for 1. The receptionist desk was also built at a certain height to allow patients who are in wheelchairs or ADA friendly to approach the desk. Looking at the project as an overall, at the overall scope of the project, there were 2 things that we wanted to keep in mind. One was we wanted to design this clinic very similar, if not exact, like our other ones. And then 2 was the ease of maintenance of this clinic. So that way it's easier to maintain the clinic. So looking at a couple things in the patient waiting area for that specific purpose is the patient waiting area has its own HVAC unit or heating and cooling system. This will help in colder months. With older glass, they tend to transfer heat or transfer the cold very easily. So the standalone HVAC unit should help provide a warmer or a colder environment for the patients waiting in the lobby. We also made sure to implement a vestibule. Even with the limited space of the project, we wanted to make sure that we had a vestibule, as that also helps maintain the heating and cooling of the building. Some overall things of the project. The project is just under 3,000 square feet, or the clinic is. It has 5 exam rooms and it was built out to house 2 providers at max. So that's kind of everything in the waiting area. A couple other things I wanted to touch on as going off the ease of maintenance is we installed a different chair rail than we did at any of our other clinics. This chair rail allows it to swap out easily if it's broken, and it's also easy to wipe down for infection control. As you walk through the clinic, you will notice that it is LVT throughout the clinic. This also was a maintenance thing. Easier to maintain, easier to clean, doesn't really stain. So this first room here on our right is the screening room. Just like our other clinics, it's right at the start. There is a storage room in the back. We have 2 storage rooms in this clinic. So walking over here, off to our left now, this is our receptionist area. It was housed to house 3 people. I think I said that already. Then we can walk into the first exam room here. All the exam rooms are on the right side of the clinic. Then we have the nurses station and then the provider area. So as we walk into our first exam room here, the design and the layout mirrors a lot of our other exam rooms and all of our other clinics. One thing that we did want to make sure that we got in this one is we wanted to protect the patient's health information and make them feel secure. So we put soundproofing insulation in the walls and in the ceiling to help block sound from other rooms transferring in, as well as sounds from this room transferring out into the hallway. So if we walk across here and over to the first office, there was 2 offices in this building. As I said, there was for 2 providers. Looking at this office, it's a pretty standard office, 1 workstation. Same thing for the offices as we had for the exam rooms. We wanted to provide the security, the soundproofing, just like we did for the exam rooms. So these walls are both have the soundproofing installation, so does the ceiling. As we walk back out into the main hallway, we have the nurses station. This is built to house 4 or 5 MAs, depending on the need of the space. Off to our right here, we do have the scale room. This is where patients will first come when they are brought back to get height, weight, and other medical things. One thing I will mention here is our signs. So we have the we wanted to make sure that our signs were very ADA accessible. So we have the English, the Spanish, and then the Braille translation as well. And then this is the other office in here.
It's been really exciting opening a new clinic here in Windsor because we noticed even from the moment that we opened the first week, our schedules were pretty much full, and we've had a lot of patients expressing that they're happy that we're here. We have many patients who are existing patients of Sunrise who were traveling to Loveland or Greeley to get medical care because they didn't have somewhere nearby that accepted their insurance. And so they've been, expressing a lot of gratitude that we're here and that we're more local, that it's easier for them to get care and not have to travel so far, take so much time off work, etc. So we've been seeing a lot of people excited that we're here, and that's been really fun. Yeah.
This is the other storage room of the clinic. When we designed these storage rooms, we wanted to maximize as much space as we could use in them. Since this is a smaller clinic, there's just not a lot of space for storage. So had to maximize potential space there. So we walk through, we have exam room 4 and exam room 5. At the back of the clinic, we have the 2 bathrooms, and then we also have our lab space. Our lab space is pretty typical, and it matches up with a lot of our other lab space. It houses all the lab equipment that supports the clinic, and it also has a pass-through door for the bathroom. Now, if we want to walk into one of these bathrooms, so the one thing that I wanted to point out in these bathrooms is that everything is automated. So the toilet is automated. It has a wave for flush. The soap dispenser is automated, and then also the paper towel dispenser. We did this to really maintain on infection control, and it's throughout the clinic the same way. One other thing that I will touch on about the bathrooms is that the bathroom signage. So we made the signage unisex bathrooms. We did this to be more inclusive. That's it. We have a water fountain here, the other bathroom, the IT room. So the last room of our clinic is the break room. So we designed the break room. We wanted to make sure that it could house most, if not all, of the employees of the space. We just had really basic kitchen appliances, just a microwave and fridge. The fridge does have a freezer, and then we just had a small table for people to get around. And then leading into the last thing was the eye wash station. If something gets in your eye, we have a place for that to wash out.
What has drawn me to Sunrise is that I've been a patient for a couple years now, and they really take care of you, and they help you out a lot. But what really drew me to them is that they have they accept Medicaid and stuff like that, more financially helpful towards people. I know like times are rough right now, and it's more convenient for me. I live here in Windsor. I used to go to the one in Greeley. It's like a 30-minute drive, and this one's just a couple blocks down. And yeah, but Sunrise here in Windsor has really helped me and my family.